Hello, today I'm going to talk about electroconvulsive therapy. This is a very effective therapy for select cases. However, it is often wrongly viewed as a scary treatment through its portrayal in Hollywood movies like One Flew Over the Cuckoo's Nest. Electroconvulsive therapy involves the application of electrodes to the head to induce a convulsion. This is carried out under general anesthetic and muscle relaxant. When it was first used, ECT was given without muscle relaxant and anesthetic. This has created the frightening image of ECT, which has been hard to remove ever since. The most common indication for ECT is severe depression. This includes treatment-resistant depression, depression where a person refuses to eat or drink, or depression when a person is suicidal or at risk to others. Other indications for ECT include catatonia or prolonged and severe mania. Electrodes can be placed on one side of the head, usually the non-dominant hemisphere, or both sides of the head, bilateral. Bilateral ECT is considered more effective, but unilateral will give less side effects. Therefore, we need to balance the benefits against the risks. Unilateral may be considered in the elderly or those who have had side effects from previous ECT sessions. In ECT, an electric current will be passed through the patient to give a generalized seizure. This seizure will typically last 30 seconds and can be visualized on an attached EEG. In ECT, the pulse and blood pressure will increase and the cerebral blood flow will also increase. In the UK, most patients will receive a course of 3 to 6 weeks of ECT, where they will have several sessions per week. 8 out of 10 patients who receive ECT for severe depression respond well and report that they feel back to their normal selves. However, there are some side effects to ECT. These can be divided into short and long-term effects. Short-term effects include anesthetic risks such as sore throat and nausea and vomiting. Other short-term effects include muscle aches, headaches, dental and oral trauma, and peripheral nerve palsies. Long-term effects include amnesia. It is important to remember that ECT cannot be given in certain scenarios. This includes if a patient has had a recent MI or a recent stroke or a cerebral aneurysm. Moreover, if a patient has had an unstable fracture or raised ICP, ECT should not be given. Therefore, we need to have a thorough look through the patient's risks of receiving ECT and the benefits, and make an informed decision whether ECT is appropriate for the patient. This concludes my presentation. Thank you for listening. I hope you enjoyed the video, and if you liked it, please don't forget to hit the like button and subscribe to this channel.